and I really thank you, the witnesses, for testifying today. It's been very informative. Unfortunately, I was at telecommunications for a while, but I'm back now. Dr. Volkov, do you think that the process for conducting research on Schedule I substances, coupled with the limitation on the supply of research-grade cannabis, have discouraged some researchers from investigating the compound?
The answer is yes, and it has slowed it down, yes.
Okay. Let's see, I have a couple questions here I want to go over. Mr. Straight, would you agree that scientists studying cannabis and its effects, either bad or good, is a fundamentally different question than legalizing, decriminalizing, or even discussing medical or recreational cannabis?
Absolutely. We want DEA, just like our colleagues at HHS, want to be tethered to science as it pertains to marijuana, research with marijuana.
Very good. Let's see. Next question is for Mr. Throckmorton, Dr. Throckmorton, excuse me. Are products available in state-regulated markets like edibles, concentrates, oils, wax, tropicals, for example, et cetera? I mean, those particular products, are they commonly available to clinical investigators through federal sources? And if not, how might that pose a risk to the public health?
So I wouldn't be able to comment on their availability to the non-drug centers, because that just isn't part of what I regulate. I focus on the drug side. On the drug side, with the passage of the Farm Bill, hemp-derived compounds are now available for research, and we're eager to support that any way that we possibly can. We think that's an exciting new avenue to get some of the questions we really desperately need answered.
Doctor, one more question. With the recent spate of lung illnesses related to illicit THC vaping products, what were some of the key takeaway lessons learned regarding the federal state of oversight and research into current products and consumption methods?
Sorry, I thought it was you were asking.
Yeah, no, this is for...
you're bringing up an example about why
and I'd like
we need so much more knowledge. We did not know about hyperemesis until 2006. And as a result of that, we didn't know how to diagnose it. Now we're seeing it in the medical emergency rooms, and it's associated with high-content THC and chronic use. But we are just assuming, based on what the patients are telling us, since we are unable to actually sample from the sources that they are consuming. And that's just one example about why we need to understand the consequences of consumption of different products of marijuana, because we are seeing adverse effects. And so if we want to proclaim, well, there are medical qualities to it, and we need to have evidence to show that it is the case, we also need to understand how to optimally dose it and what product characteristics are safe. And we don't have that data.
Thank you. Dr. Throckmorton?
I just want to say Dr. Volkov's raising an incredibly important point. Patterns of use, how these substances are being used, are changing year to year. The new uses, cannabidiol, vaping, things like that, just the ways these are being consumed, the doses they're being consumed, the populations, the perceived benefits are all changing. We as a federal architecture need to find some way to track that, to understand it, to identify new risks as they emerge quickly, ideally find new ways to assess efficacy and things like that are identified. But it's a central challenge, I think, for all of us working in this area.
Well, thank you very much, and I agree. I'm going to yield the rest of my time to Mr. Griffith, please.
Thank you very much, Mr. Straight. Several studies found that research-grade marijuana from the University of Mississippi is genetically distinct from the marijuana coming from state dispensaries, such as we heard